This is a balancing act, starting to shut down again, it could cause irreparable damage, irreparable harm to people and their livelihoods on a permanent basis where they won't come back to a job. There won't be a job for them to have. This is a balancing act. Starting to shut down again, it could cause irreparable damage, irreparable harm to people and their livelihoods on a permanent basis, where they won't come back to a job. There won't be a job for them to have.
Good afternoon. I'm Karen Tumulty. I'm a political columnist here at the Washington Post, and please pardon the technical difficulties on my end, but I want to welcome you here this afternoon for our conversation with Miami-Dade Mayor Carlos Gimenez. Thank you so much, Mr. Mayor, for giving us some of your time today, which I know is very, very precious. I just wanted to start by asking you how things look right now. Florida has seen within the last week some of the biggest increases in coronavirus infections, and Miami-Dade area is the epicenter of Florida. So how are things looking at this moment?
Well, actually, today, the last week or so, we've actually slowed the growth down, and we're also seeing the contagion level, the positivity rates start to level off and start to actually go down. So those are pretty good. That's pretty good news so far. So it's not to say that we don't have a lot of people that are going to the hospital, that we don't have a lot of people in the hospital. We do. We have about 2,200 people in the hospital, about 500 people are in ICU, and we have about 300 people on ventilators, which is much higher than it was, say, just 3 weeks ago. But we saw a huge spike about 2 to 3 weeks ago started that got us from like 800 people in the hospital to about 2,000 pretty quickly. So I think we've leveled off in terms of the spiking, and hopefully we're heading in the right direction.
When this whole pandemic first began in this country, it really looked as though Florida was going to be spared, relatively speaking. And, the governor started to reopen the state in the middle of May. I mean, how did you feel about that decision at the time? And what does it look like in retrospect?
Well, the governor started opening up other parts of the state because, frankly, they didn't have the same level of contagion that we had here in Miami-Dade. He allowed us to open up a week or two later. So he's given us a lot of autonomy down here to do different things that are happening in the rest of the state because, frankly, things were different here in Southeast Florida. Dade, Broward, and Palm Beach is where the bulk of these cases were coming from. And so, look, we were down, the gating criteria was 10% positivity rate for over 14 days. We were down into the 7-8% rate. We put together a whole group of different industries along with our medical advisors to see how we could start to open up in a safe way. We were very cautious in the way we did it. We've had a mask order here since April. We've been giving our seniors and giving our seniors food at home since March. We closed down our community centers, our elderly community centers. And so we felt that and our medical advisors also felt that the way that we opened was safe, and had people complied with that, I don't think we would have been where we are right now. I think a lot of it had to do with how we as a community, how my community, how we all kind of felt maybe that this thing was over. Summer's coming, and people are telling us that summer's going to be good, and I just don't think that they complied with the orders, and they kind of let their guard down, and I think that's what happened. We saw a big uptick in the middle of June, which probably started right around June, and there are probably a number of factors for that.
And how do you rate the federal response in all of this? The president says that state and local leaders are getting everything they ask for from the federal government, everything they need. I know that the leadership really does have to be at the local level, but how has Washington responded?
Look, I think Washington has responded the best they could. When everybody is asking for PPE at the same time, usually the nation's disaster response is not geared to a full nation disaster response. It's actually geared to a disaster hits one state, one area, maybe 2 or 3 states at the same time, not 50. And then this pandemic is, hit all of us about the same time. And then we had this shortage of PPEs and other equipment. We got our share, we got our fair share. We never ran out of PPE. That's good. And people were thinking we're going to run out. Never did. So the federal response that I've gotten down here has been fine. I have no complaints about the federal response. I also know that, you have to, when something like this hits, there's prioritization. And then this thing really hit New York harder, much harder than it's hit Miami-Dade and early on. So a lot of the focus had to go to New York State, New York City, that tri-state area, because that's where the virus was and that's where the deaths were occurring. And you have to prioritize as a nation. And so I have no complaints about the federal response. Today, we just opened up another testing center, 2 more testing centers, pop-up testing centers that weren't there yesterday are here today. And I was with the U.S. Surgeon General, General Adams, by the way, a terrific person. And he said, whatever you need, we just let me know and I'll get it down there. So I'm going to take him up his word. Right now, we're fine, we're okay, and we're getting the support that we need.
And one of the big decisions that every state and quite frankly, practically every set of parents in the country is going to have to make, and over the coming months, is the decision of sending children back to school. The largest teachers union in Florida has sued the state to prevent it from reopening. Where do you stand on reopening schools, and what threshold do you believe needs to be met before it's really safe to bring kids back to school?
Well, look, every community is going to be different. The level of contagion in every community is different. And so, again, speaking with the Surgeon General, today we agree that we need to bring the level of contagion down in Miami-Dade County below, we're running at around 17, 18% right now, 20%. We need to bring that way below 10%. And then when we do that, then we may be able to do, maybe able to open up some schools in some capacity. I'm working with the superintendent of schools, Alberto Carvalho, here in Miami-Dade. We have put together a small task force of medical advisors to advise us as to what the proper course of action is. It's premature right now to say, are we going to open or we're not going to open, because we don't know where this virus is going to be 4 weeks from now when it's time to open schools. So we're not going to do anything that is going to put our kids in jeopardy. And also, we have to understand that even though, kids may get this at a lower level, kids may even spread it at a lower level, you have to, take into account that these kids are going home to their parents. And in this community, a lot of them are, 3 generations where you have parents and grandparents living in the same household. Those parents and grandparents are much higher risk than the kids are. So it's not just the kids that we're looking at. We also need to look at what are the ramifications of those children getting infected in school and then coming back and infecting their parents. With the contagion level that we have right now, I'm not comfortable with that. And I think that is consistent with what the messaging I've heard from the federal government, that different areas are going to be treated differently and should be treated differently, because the virus is not homogenous throughout the country. Certain areas are getting hit harder and certain areas are not getting hit as hard. And so it all depends on where you are.
So as you talk to your medical experts and talk about the path forward, what does it look like to you? And what are some of the other really big decisions that state and local leaders are going to have to make beyond opening schools over the next few months?
Well, look, here we have a curfew at 10 o'clock at night, and we did that to curtail what we call social activity, because we felt that it was this social activity that really caused us to jump up from a positivity rate that was hovering around 7 or 8% to over 20%, like at the snap of a finger. I mean, it happened really quick. And so we have a curfew that obviously, I'd like to, remove the curfew, but not right now, curfew 10 o'clock at night throughout Miami-Dade County. We have all of the, what we call, places of assembly, like theaters, movie theaters, casinos, museums, banquet halls, those things where large numbers of people gather, they're all closed. And then we also close the interior spaces of restaurants. You can have a restaurant open as long as it's outside. Inside, you can't. And that really is a big industry here in Miami-Dade. And so what am I looking at? I'm looking at trying to get the level of contagion down to a certain point, and then starting to reopen the county. But again, re-emphasizing that it's not over, that we all have to keep our masks on, that we all have to maintain social distancing, that we all have to wash our hands, and even in the home, we have to, watch out for one another, because there could be a member of the household that is COVID-19 positive, doesn't know they're COVID-19 positive, and could spread it to more vulnerable members of the household. And so those are the things that I'm looking at. Hopefully, we've topped out on the positivity rate, topped out on our hospitalizations, and start to go down. But if not, if it starts heading north again, then there may be some other measures that we have to take, but always doing that in consultation with our medical experts.
You mentioned masks, and you have been a big advocate from early on for people putting on a mask. You say that they save lives. You've even said that if President Trump comes to Miami, you want him to put on a mask. Are you finding that this is now finally being accepted, these recommendations by people, or at this point, should there be a national masking order?
Well, again, look, just like in the state of Florida, there are different levels of contagion in the state of Florida, and I'm sure across the nation there are different levels of contagion. So I think those decisions are best left to the local leadership and the local. I'm the mayor of Miami-Dade County. I represent 2.8 million people. I am also a former firefighter and a paramedic, and so I know a little bit about this. Now, when this first started, everybody, the CDC, the best medical advice we got was do not wear masks. And that caused a little bit of confusion. And I think that the reason that they said do not to wear a mask is that they, unlike any other virus that I've seen in a long time, or ever actually, there's a high percentage of people here that get the virus that display zero symptoms. They don't feel anything. They feel fine, upwards of 50%. And so, on a normal kind of disease, you get a runny nose, you start coughing and all that, and then you're contagious. COVID-19 isn't like that. So the CDC had to change its recommendations, and now we have to assume that everybody is contagious, and that I'm contagious, that you're contagious. We have COVID-19 and we don't know about it, and so we may be spreading it. So the use of masks is very important. We've had a mask order here since March. Interior spaces, we had it for outdoors also if you could not maintain a social distance. About 3-4 weeks ago, we changed it to outdoors, masks all the time, indoors, outdoors. We recently just passed some legislation to also do some civil citations concerning not only the use of masks, but also all the other rules and regulations that we have put in place to make it easier for our police officers and our code enforcement officers to ticket people. And we've already ticketed over 100 people, and I don't know, something like 40 different businesses, and we've closed some businesses for not adhering to the rules. So do I find it easier? Yeah, I find it easier because we're really homing in on it. We're really accentuating it. And and because some people didn't follow our rules, that's why we had to close some businesses. And when we close businesses, we're hurting your neighbors. These are our neighbors. These are their jobs that we're hurting. And so it's a sense of community. My message is that I wear a mask to respect you, because I don't know if I'm contagious or not. You should wear a mask to respect me, and then we should always wear a mask to respect the community, because you're a member of the community. And it's not much to ask to wear a mask, keep your distance, wash your hands, and if we do that, we can beat this. We can beat this virus.
Well, we have a couple of questions from our audience, in fact, from Florida, that I would like to ask you. One is from Bart Sullivan. You had mentioned earlier that Miami had higher infection rates early on than other parts of the state. Why is Miami the epicenter of COVID in Florida?
I think there's a number of things. Number one, we have a lot of young people. And we also have it's a little bit different than maybe other parts of the United States. 60% of the people that live here were not born in the United States. I wasn't born here. I was born somewhere else. And we also tend to have a much higher, I think, percentage of our families that are here. Our families aren't spread out. My children, my grandchildren, my cousins, they're all here in Miami. And we are a very family-oriented community here, and we like to get together. And I think the reason why we're an international city, we had a lot of people initially. We had a lot of people from New York that were here, and we had to quarantine the folks from New York. Now they're quarantining the people from Florida up in New York. So that's the way things change. But yeah, because we're an international gateway, and also we had a lot of travelers from New York, and we have this community and family that's maybe a little different than the rest of the country. That's why you would see that we'd have a little bit higher contagion here in Miami-Dade. We're called the Gateway of the Americas for good reason. Our airport has about 120,000 people, or had 120,000 people a day traveling through it, and so you probably had that. We were also the host of the Super Bowl in February, and I'm sure that brought a lot of the COVID-19 infection into Miami-Dade too as well. So there's a number of factors of why we're the ones that are the center. We're also by far the largest county, and by far the densest county in the state of Florida.
And from Jim Turner, another Floridian, you had mentioned earlier your program that you started early, delivering meals to the elderly. Miami-Dade does have a high percentage of an elderly population. What else are you doing to protect your older citizens who often have comorbidities with COVID-19?
No, I know the state's doing a lot with the nursing homes and ALFs. That's under the purview of the state, and they've really kind of put a cocoon around the nursing homes and the ALFs. We also didn't, we saw what happened in New York, transferring patients from hospitals into nursing homes. We don't do that. We do the opposite. We take them from nursing homes, put them in hospitals. One of the first things I did, I think my first order after I declared an emergency, was to close all of the community centers here. Here in Miami-Dade, we have a number of community centers that are for the elderly, where that's where they socialize, and they also get a meal. We closed all of them down, and then we started delivering meals to about 75,000 elderly residents of Miami-Dade on a daily basis. And so we've already delivered millions of meals to the home, to the elderly, so that they don't have to go out. Because again, we also say we're safer at home. So our message to the elderly is, you're safer at home. The more that we can keep you in your home, and the more that you also, I know it's painful, keep away from family members that don't live with you, then the safer that you're going to be. And so those are some of the things that we did here to protect our elderly. And we've had about 1,200 deaths here in Miami-Dade, but that's far less than what happened in New York and New York City, even accounting for the difference in population. Like I said, we have 2.8 million people here. There's 8.2 million people in New York, but they've had a much higher death rate per thousand in New York City and New York than we do down here in Florida and Miami-Dade.
Well, I'm a political columnist, so I will be remiss if I don't ask you about politics. Right now, you are running for Congress for the Republican nomination in a primary that will be held next month. And if you win, you are going to face incumbent Democrat Debbie McCarsell-Powell. You have the endorsement of President Trump, even though in 2016 you had said you planned to vote for Hillary Clinton. I guess this is one of the few instances where the president is willing to let bygones be bygones.
Yeah.
Do you think of yourself as a strong Trump supporter this time around? And which parts of his agenda are are you most enthusiastic about?
No, I'm a Trump supporter, and I'll support the president, obviously. The parts of the agenda that I support, I think that his trade policies, I think for a long time, the United States was being taken advantage of through trade policy. So I'm very happy to support that. He's pro-police. I'm pro-police. Pro-military. I'm pro-military. He wants to overthrow get a new government in Venezuela, and hopefully a new government in Cuba and Nicaragua. I am an anti-socialist, anti-communist, staunchly so. My parents came here when I was 6 years old from Cuba, so we know what socialism is all about. And so, yeah, I support I will be supporting his economic policies. I think that his economic policies. Look, down here in Miami-Dade, when I became the mayor back in 2011, the unemployment rate here was about 12%. Just before the pandemic, the unemployment rate down in Miami-Dade was down to 1.8%. That was probably the lowest in its history. You know, that speaks for itself. And so, yeah, I'll be supporting the president and his policies of economic strength. I also have a strong environmental record, and I believe that the only way to deal with the effects of climate change, sea level rise, is through a strong economy. And so I'll be I'll be supporting the president. I am a center right Republican. I am a fiscal conservative, and I've demonstrated that during my time as mayor of Miami-Dade. We had the largest tax cut in Miami-Dade County's history. We saved close to $2 billion of the taxpayer money with that. Another $2 billion in refinancing costs, and kept the tax rate flat for the last 9 years here. We haven't had any tax increases, but we've increased our services, and we've increased obviously our employment situation here is much better. And we've grown here as a community during that time into one of the hottest, if not the hottest, and I'm not talking about just the temperature, I'm talking about real estate wise, investment wise, cities in the world. And I'm very proud of the record that I've had as mayor of Miami-Dade.
And is there anything that the president hasn't done or that you would like to see him do differently with respect to the coronavirus?
Well, I mean, the president is leading on the coronavirus, but again, it's such a diverse what this virus is doing in different parts of the country at different times. Makes it that it's the governors and the local leaders that have to respond. What we require of the federal government for any kind of emergency really is help when we need it. And one of the things that we have here in Miami-Dade that probably sets us apart from a lot of different areas is that, look, we face a disaster like every year. It's called a hurricane, all right? And we face hurricanes here every single year. And we're prepared for hurricanes. We're the best prepared county in the United States for hurricanes. We know we need to be self-sufficient for a certain period of time, but then when we require help, we expect that help to come from the federal government and the state. But we also understand that we have to take care of ourselves for a while. And so maybe that's just the way we are down here, that we kind of look to ourselves and say we're going to take care of it. But what I expect from the federal government is support. The medicines that we need. If I need additional personnel to staff more hospitals, to get them open or get more rooms open, that's what I expect the state and federal government to help us with. And then any kind of information, data that may be helpful for us in making decisions here. That's what I expect from our state and federal partners.
Well, thank you very much, Mr. Mayor, and we very much wish you well as you continue to try and get this pandemic under control. Thank you so much for joining us today. And for those of you who are watching online, please tune in tomorrow at 11:30 a.m. when my colleague Robert Costa will be interviewing Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases. Next Friday, Bob's guest will be former New Jersey Governor Chris Christie. Thank you so much for being with us today, and I apologize for our technical difficulties on this end.